Today, I am pleased to report that 6,811 Albertans have now recovered from the virus, leaving 386 active cases in the province. Currently, 53 people are hospitalized, with 6 of those admitted to ICU. We have now completed more than 325,000 tests. Out of 7,746 tests completed over the past 24 hours, we identified 30 new cases. I know that many people are excited that Stage 2 has arrived and that many others are wondering what this will mean for our province. Will we see increases in cases and new outbreaks? If so, how do we respond? It is important for all of us to remember that this virus is not gone. COVID-19 is still circulating in our communities and will do so for many months to come. With the increased opportunity for activities and gatherings, there is increased potential for all of us to be exposed to COVID-19. Over the past few weeks province-wide, we have begun to see a younger demographic testing positive for COVID-19. 60% of our currently active cases are under the age of 40, and we are seeing a particular increase in those between 20 and 29. It is important for younger Albertans to remember that while you may not be at risk for severe outcomes of infection, your actions are critical to protecting those around you who are at higher risk. Recently, we have also seen a rise in cases in Edmonton. In the past 3 weeks, the number of active cases has risen from 58 to 149. While any increase is concerning, there has been no single source or cause identified. About 2/3 of these cases are linked to known sources or outbreaks, and about 1/3 are not yet linked to a known source. We are watching these cases closely and will communicate to Albertans if there is any cause for alarm. I have been asked if the increase early this week might partially be the result of recent protests in the city. I can tell you that is not the case, as any transmission would take days to work through the system. We have seen a rise in our testing numbers in the past few days, as those who attended protests have responded to my recommendation to be tested. But to date, we have not identified cases where attendance at a protest was determined to be the source. Having said that, it is important to stay vigilant. The freedom to protest is a critical one, and preventing the spread of COVID-19 is also critical. We have worked with several of the groups who organized recent demonstrations to put together a guidance document for organizers and attendees with ways for demonstrations, marches, and rallies to accomplish both goals of raising voices and preventing spread. Options include using virtual means, car rallies, and groupings of 100 with distances between the groups. I would like to remind anyone participating in any future demonstrations to stay 2 meters away from one another and to wear a face mask while attending. I also strongly encourage anyone who attends a protest or any other large gathering to download the AB Trace Together app. This will help speed up contact tracing should a case be identified. The other piece I want to speak about today is that I know that many Albertans have been struggling with addiction and mental health issues throughout this pandemic. According to the Canadian Centre on Substance Use and Addiction, 1 in 5 Canadians who drink alcohol and have been staying at home more due to the COVID-19 pandemic say that they have been drinking daily since the beginning of May. The AGLC has reported sharp increases in the sales of wine, beer, and liquor, as well as cannabis, since our public health measures were put in place. I know this has been and continues to be a stressful time. Unfortunately, high-risk use of cannabis and alcohol can cause other health problems. If you are struggling, I want to remind you that confidential support is available. You are not alone. We are working to reduce any barriers that might be in place to access the mental health or addiction supports Albertans need. Alberta's mental health helpline is available 24/7. It is toll-free and offers confidential support for mental health concerns. Alberta's addiction helpline is also toll-free and available 24/7. It also offers confidential support for alcohol, tobacco, drugs, and problem gambling. I encourage anyone in need of help to visit alberta.ca for more information on all the supports that are available. So with respect to checking temperatures, we know that not everyone who has COVID-19 has a fever as a part of their illness. And so as a standalone measure, if that were the only measure that were being put in place, that wouldn't be sufficient to catch all people who might be ill. So with respect to using that as an adjunct to multiple other measures, as you know, that's something that has been put in place in Alberta for returning international travelers, and it is something that is a part of a multi-step process. So again, as a standalone measure, it would not be considered to be effective. It does need to be partnered with multiple other interventions and screening tools. And so I think as the evidence continues to emerge, we'll be watching closely to see whether or not using a temperature check would be something that would be helpful in other settings. At the moment, it really is focused on that international travel setting, and it's not at the moment used in any other settings in this province. And again, we'll continue to watch evidence and determine whether or not it could be a useful adjunct to include with other measures that are in place. People are, I think, feeling encouraged by the restrictions being lifted and perhaps maybe going above and beyond what was intended by the restrictions being lifted. So we're seeing social gatherings, we're seeing parties and celebrations where people are coming together, sharing food and drink, enjoying each other's company after having been apart for a long time. And again, I want to emphasize that it is completely natural that we all would want to enjoy social interaction after a time of having been apart. But the important thing to remember is that COVID has not gone, and it will not be gone for some time. So the common pattern, again, seems to be more socialization, getting together in groups and sharing food and drink, and not maintaining that 2 meters of distance. And also, I think the other reminder is that when someone is feeling ill, that they should stay home, they should not go to a party, they should not have a party, because really when people are feeling ill, again, that's where there is a higher likelihood that they may spread infection. Having said that, I again want to say how deeply, deeply grateful I am that those who are feeling ill are going to be tested, because the last thing that we would want is for those who feel ill to be out and about, to be interacting with people, but then feel ashamed and not get tested, because then we would not have the opportunity to stop those chains of transmission. So again, I want to remind people, if you are feeling sick, please stay home and get tested and make sure that we can then work together to stop the spread.